Hello everyone, this is Saumya Dhasmana. I am a psychologist from Srinagar, Garhwal, Uttarakhand. Welcome to my YouTube channel. Today I'll talk about cognitive behavioral therapy. It is a very effective therapy. This therapy was developed by Aaron Beck in the early 1960s. He was an MD and an assistant professor in psychiatry at the University of Pennsylvania. He identified that distorted negative thoughts and beliefs as a primary feature of depression. He then developed a structured and present-oriented therapy of depression, which helps in solving current problems and modifying dysfunctional thinking and behavior. Here, dysfunctional means inaccurate or unhelpful. Psychotherapists use this therapy to treat almost all kinds of mental health issues. In this COVID-19 crisis, most people have mental health issues. People have hundreds of automatic thoughts every day that affect their behavior. In CBT sessions, we first of all identify current thinking and problematic behaviors. For example, you are worried about your health. You have a fear of death because of coronavirus. Then you need to identify all of your negative thoughts at that moment. Identify and recognize them. Then check the validity of those thoughts. Question yourself if your negative thoughts are really true. Then you will get better answers yourself. In this lockdown, when you can't go for therapy sessions to the psychotherapist, you can yourself make use of CBT techniques to solve your problems. The ABC model is a basic CBT technique. This model was created by Dr. Albert Ellis. He was a psychologist. Here, A stands for activating event, B for your beliefs about the event, and C for consequences, which includes your behavioral or emotional response. So CBT focuses on changing beliefs in order to create more positive consequences. Using this model, the therapist helps the client explore the connection between beliefs and consequences. The therapist then helps to re-evaluate these beliefs. Through CBT, the client learns how to recognize potential beliefs about adverse events, which helps the client to get better and healthier consequences and helps to move forward. Any adverse event in life may spark irrational thoughts. These thoughts lead to negative emotions like anger, sadness, anxiety, guilt, fear, embarrassment. Using ABC model, you can help explore more rational thoughts, which in turn helps you develop more positive emotions. Now, this whole corona crisis is an adverse event, which has developed irrational thoughts, which is why people are experiencing negative emotions. So, if you can't go for therapy sessions, then at least make use of CBT yourself. Or you can help your family members and friends using this technique. This therapy is based on a deep understanding of specific beliefs and patterns of behavior of the individual. The therapist focuses to produce a cognitive change, that is modification in the client's thinking and belief system to bring about emotional and behavioral change. When people learn to evaluate their thinking in a realistic way, they experience improvement in their behavior. CBT is used to treat a wide range of problems such as depression, anxiety disorder, addictions, sleep disorder, marital problems, eating disorder, phobias, and severe mental illness like schizophrenia or bipolar disorder, etc. Research suggests that CBT leads to significant improvement in the functioning of life. CBT involves efforts to change thinking patterns, learning to recognize distortions in thinking that are creating problems, then re-evaluate them. That is, think realistically, is a main focus of CBT. CBT helps the client to become his own therapist. Through CBT sessions and the homework exercises given by the therapist, the client develops coping skills and learns to change his or her own thinking and behavior. CBT therapist emphasizes what is going on in the present, that is the current life, rather than focusing on the past. Information about the client's history is needed, but the focus is on moving forward to develop effective ways of coping. CBT focuses on changing the automatic negative thoughts which cause mental illness. Through CBT, these thoughts are identified, challenged, and then replaced with realistic thoughts. The goal of CBT is to teach people that they can't control every event or situation of their life, but they can control their interpretations of the situation and the way they deal with stressful situations of their life. So that's all for today. In the next part, I'll tell you the principles of CBT in detail. Please like, share and comment and subscribe to my channel. Thank you.